My name is Dr. Benjamin Ferrell. I live in Nashville, and I'm a specialist in pulmonary and critical care medicine. Normally, in my practice, I split my time 50-50 between the ICU and the clinic. Recently, our hospital volumes have been really high. And a lot of this is driven by COVID admissions, along with ICU admissions otherwise. And this has really impacted how our group works and how our schedules and our coverage of the ICU function. For instance, on the weekends now, we require 3 doctors to come in instead of 2 doctors as we normally would. And caring for COVID patients is really physically exhausting. They are often very, very sick. But I think it's also important to note that the emotional toll that this takes on us and our staff is really profound. Once a patient comes to the ICU, we know that the patient's going to be in the ICU for a long time, sometimes 2, 3, multiple weeks. And the patient is often going to suffer a very severe course of illness. In many cases, those patients die. And right now, the majority of our cases are coming from outside of Davidson County. Having a lot of patients come from other parts of Tennessee and northern Alabama and southern Kentucky. And a lot of these patients are older and very sick. This experience has been very difficult for patients' families. I really can't imagine what it's like to lose someone in the hospital and never be able to visit, never to be able to be at the bedside, never be able to care for them in the way that I know these families want to care for them. And many times, I and my colleagues are the last people to talk with these patients before they go on a ventilator. And once a patient has a endotracheal tube and is on a ventilator, they can no longer speak. They are sedated often, and the machine is helping them breathe. And so these people are really sick, and we do everything we can to help them, but often that is not enough. And when you lose patients over and over like this, it takes an emotional toll. It has been, I would say, one of the most emotionally traumatic things I've ever experienced as a physician. And this not only goes for physicians, but it goes for the nurses and the respiratory therapists and other care providers. In fact, this summer, Dr. Stephen Heyman, my partner, who I'm very close with, became sick with COVID. And he found himself in the ICU. And I was his doctor for a week of that time. And that was really a wake-up call for all of the staff that this was hitting very close to home. And he was quite ill, really pushed the limits of what a critical care medicine could provide. But we're very thankful that he actually improved, and after a couple months away from work is now back and seeing patients in the clinic with us. This summer in July, we had our big spike in Nashville, and I worked for a week in the COVID ICU. And during that time, I was busier than I've ever been in my entire career. I worked well over 100 hours that week. I barely saw my family, and it was a hard week, to say the least. We had more critically ill patients on ventilators than I'd ever seen before. And this is not just my experience. I know this is the experience of every ICU physician in the city, is that we're seeing sick patients like we've never seen before. Not only in level of illness, but in the sheer volume. And now that we're back to another surge of COVID cases, questioning whether we're going to have the ICU bed capacity to manage these patients. We just found out that ICU bed capacity is now in the city is now down to 5%, where even in July we had 10 to 15, sometimes 20% capacity. Our ICU bed capacity is critical right now. And we think about our capacity in terms of beds, but we also have to remember that we have other resources that are limited. Our nurses, our respiratory therapists, other ancillary staff, they are on the front lines more than any physician. These nurses and RTs will spend hours in a patient's room with COVID. Many of them have gotten sick, and they are doing exceptional work in the face of really difficult circumstances. And I'm so thankful and proud to work with people who are so selfless and care for patients so well. But they're doing it at levels that cannot be sustained. We won't be able to maintain a staff of great providers like we have known in the past with the levels of COVID that we have currently. This disease is not going to just easily run its course in the community. That is not the strategy we need to take. This is a deadly illness. It's affecting patients in very severe ways. And even though most patients will get this and recover and never have to go to the hospital, we know that at least 5% of patients will be hospitalized. And as this disease spreads unnecessarily throughout our community, we're going to see more hospitalization, more death, more disability, more tragic and terrible and preventable circumstances. We're not going to have a magic trick to just fix COVID. We know what works. Wearing a mask, keeping your distance from people, washing your hands. And I can't emphasize enough that we need to be listening to health experts. We need to be listening to our medical leaders and not politicians. Our governor, Gov Lee, has not yet ordered a statewide mask mandate. I'm begging him, I'm pleading with him, Governor Lee, please require the people of Tennessee to wear a mask. It's just not going to happen on its own. We can ask, we can beg people, but until there's a mask mandate, we won't get control of COVID in Tennessee. And even then, there'll still be COVID, but we'll experience less community spread, more open ICU beds. We won't be exhausting our critical care infrastructure like we are currently. And we know this works. We know it. We've shown it in other communities. It's evidence-based. This is the science. Masks will work. They're safe for people, and this is going to protect Tennesseans, and it's the right thing to do. So I plead with you, Governor Lee, please issue a statewide mask mandate to help protect all of us in Tennessee.